Welcome back. I'm Dr. Troy Dukowitz. Here we are with your Patient Education Retention Systems overview for the month of September. Remember, our focus here is to do what? Increase patient certainty so we can increase patient retention. I'm really excited to talk to you about this month because we're looking at the month of September. What do we know takes place in the month of September? Well, if you know anything about chiropractic, you know it's chiropractic's birthday. So, what a great opportunity for us to actually dive in and give a little history on multiple planes. That's why I'm really excited about this month, because we're going to look at your history in chiropractic. We're going to look at some past history in studies of chiropractic. We're going to look at the chiropractic story, and then we're also going to look at your patient's story in chiropractic. So this can be a great month to build on, and I'm telling you, this is building towards one big thing at the end of the month, which is a testimonial drive, but we'll get there in just a second. Let's not get too far ahead of ourselves. And what else are we discussing in the overview? Your bonus tips for the month as well. So let's go ahead and get started. There are 4 Mondays again in September, which means what? We have 4 tips. Now, when you look at the first week of the month, we know that that's going to be Labor Day. And then with Labor Day means that for some of you, it's going to be a short week. This doesn't mean you slack. It means you do the work. And so what we're going to do for Labor Day week, it's a really great tip that's something you can even pull out through the course of the year if you're going to be willing to take action on this one. And we're calling it the labor of love. Now, last month, what did we do? We did a testimonial of, and we really geared it towards back to school and kids. Many of you did. And this month, we're actually telling your story. We're tying it into Labor Day, saying it's a labor of love. There's 2 options here. Option number 1, you share your chiropractic story. What got you into chiropractic? Why are you doing this in the first place? Or number 2, pick your favorite story. What's a patient? Who's a patient you've taken care of over time that has really just inspired you to want to even be a better chiropractor, or just remind you of why it is that you do what you do every single day? This is a great connection week for you and your patients to really understand your heart, your soul, and why it is that you do what you do as a chiropractor. Week 2, we're diving into the Windsor Autopsies. Now, this is a study that was done back in 1921. And in 1921, there's a doctor who actually, Henry Windsor, who actually did studies on cadavers and on cats. And his whole reasoning was because he wanted to see if what chiropractors were claiming was actually true. What's cool about this study? He found 100% correlation between diseased tissue and organs in the body of the autopsies and where it went to in the spine. So this is a really cool opportunity to, again, it's kind of going back in history. Week 1 was about your history or a favorite story that you've had. Week 2 is going back in history and saying, look, the medical profession, even the medical profession back in 1921 validated what it is that we do. And they had limited technology. Look where we are today. So this gives you an opportunity to talk about nerve system. It gives you an opportunity to talk about function. It gives you an opportunity to talk about nerves, to glands, and organs. It's a really great tip to be using should you choose to use it in week 2. Week number 3, drum roll please. Okay, so no drum roll. But week number 3, chiropractic's birthday. This is your opportunity. It's a fun week. There's so many options that we have here. Let me give them to you. Option number 1, you use a straight up tip. It's a tip about Harvey Lillard, about D.D. Palmer, and about that first adjustment. You have 2 different tips that give a little bit. One gives a little bit more of the story, the other one a little bit less of the story. You pick the one that you want to choose. However, the next option is to do a quiz. Gets a little bit more interactive for you and your patients. And there's actually a 5-question quiz where you get to ask your patients what it is that they know and what they've learned about chiropractic. For some of you, it scares the crap out of you because you're like, my patients don't know anything. But remember, the point is what? To generate conversation. So you give your patients a quiz, they take it with them to the adjustment rooms. It's a quick hit look for you because it's multiple friggin' choice. It's a quick hit for you, and it just opens up the opportunity for you to talk about Harvey Lillard, D.D. Palmer, the first adjustment, to open up that conversation and say, hey, man, we are, as of this recording, 122 years old in chiropractic. Don't we look good? So it gives you an opportunity to have that conversation, what I've also done, and what we may do this year, we haven't decided yet, is to actually have a prize. So as long as you fill it out and you get the answers right, your name goes into a drawing, and the people who actually get, the people who have to get the questions right, the name gets pulled out, somebody wins a prize. Okay, obviously, always little disclaimer, always check with your state and provincial rules and regulations to make sure that that's okay. But this is a fun event to do. Just really do it up and have fun if you want to, not just for this week, but for the month. You know, feel free to decorate your office. We put a bust of BJ Palmer in the office. We have chiropractic green books in the office, and they're kind of scattered throughout there. We have pictures of BJ and Dee Dee and Harvey in the office. Feel free to go that extra step and really create the theme of chiropractic history in your office this month, and even the celebration of chiropractic's birthday. That's week number 3. Now, week number 4. Week number 4 is a culmination of all these weeks coming to a head. And as we come to a head, here's where we go to, is asking them their story. So we started out from week 1 giving our story. Here's where I came from. Week number 2, just sharing how the medical profession has actually validated what we do in chiropractic. Do we need that? No, but it's still a good tip. Week number 3, this is where it all started. Week number 4, where did it all start for you? What's your chiropractic story? So I like to call this a testimonial drive because our focus is honed in and energized, centered on what? Getting testimonials from our patients. You're going to have testimonial sheets that they can fill out. We even have questions for kids, so you can get kids' testimonials as well. This can be a fun week, and what most of us know, what you know and what I know is, man, there are great stories in your office, but unfortunately, if we don't put our attention on our intention, we're missing a lot of stories along the way. So by having a testimonial drive, we focus our energies, hone it in on these great stories that patients are telling you week in and week out, but now you're bringing them up. And we're going to talk through the process of how to do that when we get closer to that 4th week of the month. So there you have it. There's your first 4 tips of the month of September. Now it's time to talk about your bonus tips. Bonus tip number 1. This is a really cool tip because it involves no paper. It involves nothing but the doctor and the patient. And I like to call it the recap. What this means is that for every person that you take care of throughout the course of a day and throughout the course of that particular week, you're going to make a conscious effort to recap what you did. A conscious effort to recap an area that you adjusted, and a conscious effort to talk to them about where those nerves come from and where they go to, how they affect the body. Again, this is about empowerment, about helping them to better understand what it is that you and I do. Now, you might not do it for every single person that comes in, but the idea again is what? To make sure that we're thinking about this, and through the course of the week having this conversation with 80 to 90% of the people within our practice. If you can do it 100%, it'd be great. And you can tie this in if you have nerve charts in your room, or you can carry a nerve chart with you. You can tie it into the nerve chart. A recap is an extremely valuable way to be able to recap what it is that you did today and how it affects the person that you just took care of. It's a great opportunity for you to talk chiropractic, subluxation. It's a great opportunity to talk about function as well. Now, bonus tip number 2. Dime week. No, I didn't say dime bag. Get your head out of the gutter. Dime week. You literally have a container of dimes at your front desk, and every person who comes into the office gets a dime. They are instructed to take said dime with them to the adjusting room, adjusting table, whatever you have set up, and as they lay down on the table, put the dime on the back of their hand and leave it. Doctor comes in, sees the dime in the back of the hand, it now generates a conversation. Mary, do you know why you have that dime in the back of the hand? Well, let me share with you. That's the amount of pressure that's necessary to cause interference to your nerve system. We often think of it as this big pushing, pulling, torquing, bone out of place, putting pressure on a nerve, but in actuality, it takes that weight right there to cause up to a 66% decrease in the function of your nerve system. And Mary, what's scary about that is if you leave the dime there long enough, you don't even know it's there. So those are your 2 bonus tips for this month. Dime week is an absolutely awesome week. I've done this in healthcare classes as well, where I've given people dimes, and you can see their jaws drop. Because as we explain chiropractic, we want them to understand there's this interference. And oftentimes we use big analogies or metaphors to help them to understand that. Like literally, and I know some people frown on this, well, tough. It's what they understand, not you and I. They might hear like bone out of place, putting pressure on a nerve, and they go, wow, that seems so huge, and it has to be so ginormous in terms of how it affects those nerves. And all of a sudden you realize it doesn't have to be this, it can just be this. And if you see my finger, like I'm even moving them too much, but it can just be this little shift in the system to affect that tone, to affect their function. So the bonus tips are really fun tips. They're conversational tips. The dime week also comes with an actual tip, so if you don't want to use the dime, you can actually use the tip as well. But I gotta tell you, the experiential stuff, folks, when you're putting a dime on the back of somebody's hand and they're carrying it with them, it generates conversation and it's fun. For those of you who did backpack week last month, you know this. It just generates a different energy. So there you have it. We've got our 4 weeks of tips for the month of September. We have our 2 bonus tips. Now, what do you have to do? Your job is simple, to sit down as a team or to sit down with your communication CA, talk to the doctor, determine what it is that you're going to do this particular month, if you want to switch or swap anything out, and get ready to roll. Then be ready, because what's going to happen next week? You're going to get September's very first tip. So thanks for being here. I'm proud of you for doing this. I'm proud of you for continuing to educate and empower your patients so that we can increase patient certainty, so we increase patient retention. I'm Dr. Troy Dukowitz. We'll see you next time.